Hi, everyone. Welcome back to our podcast. I'm your host, Dr. Scarlett Spain. I'm an occupational health nurse practitioner, a healthcare consultant, and I work full-time in academia at Valparaiso University. So I'm really excited about our topic for today. It's really interesting and actually something I get asked about a lot, if not most common question for people that are already practicing nurse practitioners when I kind of talk to them about my academic journey and what I do. So our topic is the MSN to DNP journey or degree. So we're going to talk about what it is and also most importantly, why. So why do people choose to do this? So I've got two super exciting co-hosts today. First one is Kacy H. Kacy is actually my first cousin. Love her to death. So we've known each other for quite a few years now. And she's a practicing nurse practitioner in Tennessee. And then our second co-host is Kacy D, who is one of my good friends, and one of my colleagues at Valparaiso University. So from there, I will let you guys go ahead and introduce yourself a little bit more. If you can kind of tell us about your journey as a family nurse practitioner, what areas you've worked in, and then briefly your academic journey. So Kacy H, we will start with you if that's okay.
Okay, thanks so much for having us. So I got my BSN in 2010, and I practiced as a labor and delivery nurse for a couple of years before I went back and got my MSN. So I got my MSN in 2014, and I actually continued to work as a nurse practitioner and as a registered nurse during that time. I went back, in 2021, October of 2021, to pursue my DNP. And I actually finished up here in about 4 to 5 weeks. I'm really excited to be, done with this journey.
All right. And then Kacy D, can you give us a little intro to, it's kind of the same thing. So who you are, your practice history, and then your academic journey.
Okay, I'm Kacy Davis, and I went back for my BSN in nursing. I graduated in 2007. For my Master of Science of Nursing, I graduated in 2015 at Indiana Wesleyan University. I have been practicing since 2015 as a nurse practitioner, but I decided to go back to school for my doctorate of nursing around the COVID era. I always thought about this is something that I always wanted to do. My hopes and my dreams were someday I would like to teach at a university, and I applied. I was welcomed in a week later, and I graduated in 2022 from Valparaiso University.
Awesome. So since we are talking about the MSN to DNP journey, I'm going to give a brief little history of mine as well. So I graduated with my ASN in 2004, my BSN 2006, did I say ASN or MSN? ASN 2004, BSN 2006, MSN 2008, postmasters FNP 2009. Then I went back for my DNP in 2012 and graduated in 2015. While I was maintaining a full-time practice at that time, I worked, occupational medicine has always been my specialty, and I was managing a clinic in the steel industry locally when I went back for my DNP. So just so our listeners know, so again, congratulations to Kacy H. That's so exciting. You're so close, and I cannot wait to support you on your big day here in a couple weeks. So my first question that I thought would be good for us to address for our listeners is, and I want you guys to think backward. So don't think about now, but when you first decided to go back for your DNP, what were your influences, or what was the reasons that you decided that you wanted to prepare yourself further? As we were all already practicing as FNP. So what was the reason that you decided to go back for your DNP?
So I know for myself, I know I wanted to teach at some point in time. Not that it's something that I want to do right now, but I know that I want to do it in the future. And I knew if I did not pursue this right now, I probably wouldn't go back and do it. Because, time just kind of gets away from us. So that really pushed me while my kids are still young to just go ahead and jump head in and get it over with. So, but, at some point in time, I would like to teach. And then when I got into this program, I really love quality improvement. So there's
awesome.
all these new doors that have opened that I didn't really think about before. And so just seeing those changes happen in practice, it's really exciting. It's really rewarding. And I could see myself doing that as well.
Oh, that's awesome. KCD, and I know yours may be similar, but that's fine. Just what was your main reasons?
My main reason for going back to get my DNP was for my family, to have the flexibility to be able to teach. I always was the head nurse practitioner in the area that I work with, that they would go to get more education. How can we make this better?
Right.
And then when I talked to a prior colleague who went to Valparaiso University, she thought I would be perfect for the program. This is something that I could do and teach and help others in the future. So I'm glad I did. I'm glad I went. But I did this for my family and for the patients that I touch now, and for the colleagues that help make better. So
Yeah. I would say my experience for my why was pretty much the same as what you guys listed too. When I started, my girls were very young, and our dean at the time had told me, and I'm like, oh, maybe I'll wait till my kids are a little bit older. And she's like, do it while they're young, because it just becomes more time consuming. And now that my daughters are both going to be in high school this year, I totally see what she was saying, that it was more time consuming as they become older. But yeah, same reasons. I thought maybe I wanted to teach, being in a management role. I just wanted to kind of expand my knowledge on leadership. Like my leadership skills, I wanted to kind of expand on that, and then organizational skills, and the things that kind of come along with that DNP. So awesome. So my next question, and this one we may have already touched on this, but I have a thought here. And again, going back, so not looking at where you're at now, but when you first started your DNP, we're kind of conceptualizing going back. What were some ways that you imagined things may change? Again, that may kind of be the same question, but any other further thoughts on that?
I think I imagine myself being a little bit more. I was worried about being looked down upon, of having this degree and being a nurse practitioner, and people thinking that I was going to be a doctor, but there was a lot of kind of mixed emotions with the whole doctor title. I don't know if you both have had that, and other doctors saying, so you're a doctor now, but you're really not a medical doctor. That was a little bit challenging, but when you educate the people around you, that definitely helped. And I think that was a great thing for my practice and the setting in the teaching role.
Yes. Yeah, I definitely agree with that. And there is confusion. I do think it's important for our listeners and everybody to know that we do not present ourselves as physicians. And, even in the clinical setting, I go by Scarlett. In the academic setting, I can go by Professor Spain or Dr. Spain, but that is not the reasoning behind obtaining this DNP degree to, further contribute to that confusion. But and I do agree. And I think that's why we get asked so often. And I don't think it's necessarily a negative thing, but people just saying, why would I do this? Like, how is my role going to change? And that's why I have wanted to do this podcast. It's really hard to put into words how your role changes. And maybe you guys can kind of speak to your own experience. But I would say when I was done with my DNP, definitely my leadership skills were enhanced. Again, that organizational skills. I do feel like it made me a better clinician as well. So a lot of the DNP coursework is focused on, and you learned that in your MSN, of course. I'm not bashing that degree at all, but a lot of that coursework, or a lot of the DNP coursework is further, finding evidence and making sure that your evidence is the best evidence that you can find. And I felt like that was really enhanced for me during that DNP journey, where, if I've got a clinical question, that I know how to find the evidence a little quicker or easier. I don't know. Do you guys have any further thoughts on that?
Yeah, that was, go ahead.
Sorry. With three.
Best practice too, that really enhanced my practicing style. I wanted to make sure I was doing the correct thing, the right thing, the best thing.
I was going to say that was evidence-based practice was like one of my favorite classes because it's useful, to everyone. And you just really digging deeper and being able to figure out how to break down a journal article and to get that information. Like I really enjoyed that. And one of the classes that almost kept me from going back to get my DNP was biostatistics. And that also was one of my favorite classes. Like I literally probably put off going back for a year just because I feared that class. So, and it was I really enjoyed it.
That's so funny. Yeah, I took biostats last year. I just got done with my MPH, and how many times did I ask you, KCH? I'm like, oh my gosh, I'm scared. And I took like a year off too because I was scared of that class. And I was like, oh, it wasn't that bad. And she actually had taken it before me, so she's like, it's not that bad. You're gonna be fine. But yeah, it took some motivation to get me to actually take that class. But so Kacy D and I are graduates from the same program from Valparaiso University, and then KCH is currently enrolled in a different university. So I just want to talk a little bit about curriculum. And I'm sure they're pretty similar just from KCH, our conversations, it seems like they're pretty similar, but our curriculum so how our things are set up at VU, Valparaiso University, you'll hear me call it Valpo or VU sometimes, is that so the MSN, the DNP, you have coursework before you get to the 799 series, which is our evidence-based practice project series. There's 3 courses in that series, but you have coursework leading up to that. So some of our courses are titled like ethical issues in advanced practice nursing, organization and systems leadership in healthcare, epidemiology is a requirement, business and legal aspects. So KCH, did you have similar coursework leading up to your final?
Yeah, it sounds like it. Yeah. So I had evidence-based practice. I had an ethics class, a leadership class that I think they're no longer going to be requiring. And I really liked that class too. So yeah, there's a leadership class, the biostatistics and epidemiology. There was a nurse educator class. I don't know if you mentioned that or not.
No, we have that it was a separate track. So
okay,
that's nice.
So they have like a companion DNP where I think some of the people that got their MSN there were required to take it. And so the companion DNPs didn't have to take that because they already took it. But since I came from a different university, there were a few classes that I didn't take. And I think they do that to encourage people to go on to get their DNP because they're like, hey, you've already completed this much coursework towards your DNP. Yeah, trying to encourage them to go back. But yeah, the rest of them sound very similar.
Yeah. One of my favorite projects before the 799 series was, and I forget which class it was in, it was maybe business in KCD. Maybe you had to do something similar. It was you either wrote a business plan or a grant proposal.
Yes, I agree. That was one of my favorite things.
Yes. And what's really cool, I feel like with the DNP program, when you're writing stuff for classes, I mean, much of your work, like the grant proposal a friend and I wrote, I mean, we definitely could have actually applied for a grant with that. Like, it's not just, faux coursework, or you're not just doing something to, meet the guidelines of the course. A lot of times the papers and the creative work that you come out with, you could publish or do something with it, which is really awesome with the DNP, In publishing is a whole nother animal that's difficult, but truly the coursework that you do, the works that come out of it is just incredible. So
I really enjoyed that program, that process, and those thoughts for that business plan, because we could have actually opened up my friend and I, or another colleague and I, we did ours on opening a Botox center, and we had
cool.
Prices for units and injections and time, and it was excellent. It was a great learning tool.
Yes. All right. So now I kind of want to touch on projects. So again, Kacy D and I have had evidence-based practice projects at the end of our DNP program, and then KCH has a QI project, and this is just different depending on different university requirements. So it's called the 799 series at Valparaiso University. It spans from summer 799A fall is 799B, and spring is 799C, and then that's when you're done with the program. So the evidence-based practice project is looking basically to analyze, translate scientific evidence into something that needs to be updated, I guess is how you could say it. So looking at best available research and then clinical experience, patient preference, and kind of putting that into clinical practice. So I do want to talk individually about each of our projects, just so that our listeners who are potentially interested in a DNP program, again, can kind of conceptualize what this would look like for them if they did decide to enroll in a DNP program. So my oldest daughter has life-threatening allergies, very, very severe allergies to peanuts, eggs at the time that this project was being done. So I implemented a food allergy plan to keep elementary students safe in a school. So this was, again, 2014 that I would have started working on it. So I pulled evidence, and it was like multiple pieces of evidence because I tried to address every place in the school or every activity that could be a school associated to keeping her safe. So this would be field trips, school buses, playground. And the main thing that came out of this is Epi first, Epi fast. But with that, anybody who's watching her needs to be able to identify that she's having a reaction, right? So that's the big thing. So bringing in best evidence as well about how to recognize anaphylaxis, when is an EpiPen needed, and then educating. And it was a charter school. So, and the school nurse there is incredible. So she was so helpful, but it was educating not only her, but every parent, because there was so much parent involvement, every teacher, every volunteer, anybody who could be within, my daughter's name is Lily, be within, or Lily would potentially need their care. So recognizing, and not only her, but recognizing the anaphylactic reaction and then what to do about it and making sure that that EpiPen was there. So that was my project. I absolutely loved it. I think it's important for people to know when you're doing this project, because you spend so much time and research on it, that it's really important to make sure that it's something that you're really passionate about. And for me, that was right up my alley. Again, something that was really relevant to me. So that was what my project was. I do note that the project is being used across the country. I don't want to say like hundreds of places, but at least I probably have had, 20 emails throughout the years of people being like, hey, can I use your plan? Because it was written I know it's being used like at a church in Texas, which is really cool. And then other like smaller school districts. So that was neat. KCD, I'm going to go to you next, just because, again, you have the evidence-based practice project, and then we'll go to KCH to talk about QI a little bit.
Okay, what I did my project on was improving osteoporosis screening rates of women in a primary care setting. I was not at all in a primary care setting, but we had to do that in a family primary care setting. So I had talked to another colleague and a previous DNP grad as well. And I actually had my clinical site at her office with her collaborative physician. So I guess they were having a lot of problems in this rural area with getting women in there to get their DEXA screens. It was on the low priority. Everything was emphasized on breast cancer and getting your mammograms and everything but this. This is on the low end of the totem pole for priorities. So she thought we could maybe do something in that area to help in that process. I did do some research, Dr. Cook and I did my literature searches, and that took a long time, but I finally found 10 pieces of evidence for those to increase screening rates for those at risk for osteoporosis, with my intervention being a patient mailed reminder letter. I had this written, I wrote it myself. I had our HR and our marketing team help with processing this letter. It was completely compensated by the organization that I used to work for. We did send out these letters to 77 women who did not have a DEXA screen on their primary care chart. At the very end, there was 72 that were able to receive these. I had deceased in the meantime, but these letters were sent around National Osteoporosis Month in October, which was a great marketing tool as well, and this kind of spun off of other things. But what I did was compare the data from those that did get the DEXA screen from this evidence-based practice project, from this intervention being the letter, comparing that to my pieces of evidence that did this exact same letter for increasing screening rates, whether it be a mammogram or PAP. And we kind of compared those two data pieces with the statistician that I hired. And I used the binomial test, which was new to me, but he said this is a great tool that we can use to statistically analyze these two pieces of data. But in the end, it did significantly impact the outcome of those getting the DEXA screen. So it did.
Oh, that's awesome.
It did do something, even though 6 of them did get it. It was correlating with the evidence from my 10 pieces of evidence, the literature reviews.
Right.
Obtained. So.
Oh, that's awesome.
Yeah, it was great. I was really happy about it. It was a great project. I learned a lot. I had a lot of support. And what my previous organization is now doing is sending screening, mailed screening reminder letters for other things as well. So this is great. It's a great thing.
Oh, that's awesome. And that's the whole point. We want our projects to be sustainable, so that wherever this project was done at, that it is a change. It's great if there is a positive outcome, of course, but that there's a the sustainability of it is there, that this can be further implemented once you're no longer a student. So, oh, that's awesome. And I don't think I've ever knew what your project was. So I'm glad I just got to hear. It's funny after how many times we've talked and that's never come up. So, oh, that's awesome. All right. So now Kacy H, will you tell us about, again, she does for her university, a QI project. So tell us a bit about that.
Yeah, so I guess I'll talk about the QI model first, because it is different, it sounds like, than EBP. Whereas for QI, you don't pick your topic. The topic has to kind of find you. Yep. And so you started off by doing chart audits. And so I did 50 charts where I just got all the information I possibly could. And you're kind of just searching for gaps in care. Okay. So you don't really get to pick like your passion topic or whatever, but my topic ended up becoming my passion. Oh, that's awesome. So yeah, really. So my topic was perinatal anxiety and depression, standardizing effective screening and management, because the practice I was in, they were not screening with a validated tool. They were simply just at their postpartum visits, just asking if they were feeling blue or down and things like that. And then that was kind of where it ended. So for quality improvement, I'm going to say this really slow or I'm going to mess it up. So it is 4 rapid 2-week plan, do, study, act cycles implemented over 8 weeks. Okay. So you have your 2 core tests of change that you start off with, or just 2 core interventions that you start off with. Mine was screening with the EPDS, that was my tool, and then also Right Care, which I used a point of care checklist for. Okay. So my initial changes, they came from my baseline team surveys and patient surveys, and then my chart audits. And then after each 2 weeks, I would have to input all my data into run charts to track changes over time and to see if there were any kind of special causes of change or common causes of change that are indicating improvement. And so after each 2 weeks, I would make a small test of change for each one of my core interventions. And then I would go through the whole process again and see how my data is turning out and see what I can change next to make it better and better and better. So by the end of the 4 cycles, I then have what worked and what didn't work, and then what my recommendations for sustainability were. So it ended up being really successful. We had a team that was just highly motivated. Every single thing that I threw at them, they were just ready to jump on it and ready to do it. We only had 1 test of change that was a flop, which, I mean, it's going to happen. Yeah. So I had this great idea that we would use the EHR to its maximum potential, and that we would everybody that was screened and that had follow-up in management, that we would put it in a quality measure that was in their EHR already, but they weren't used to using that. So in 2 weeks' time, it flopped majorly, and they have their own system that works better, and that's totally fine. But everything else, we went from, a PAD rate of 2%, and the state rate is 16%. At the end of the project was 32% positivity rate.
Wow.
So 32% of the people that we screened had perinatal anxiety and or depression. And then we did a referral log. And so 1 week later, I would follow up with these patients to see if they completed their counseling referral. And I could talk about this for like hours, but I won't go into all the minute details. But it was just really cool to see that, just coming in there for 8 weeks and doing this, it created a wake of change. And I even had the front desk, they called me last week and they said I had created a education resource that was our decision aid that kind of helped us streamline our communication and make just talking to the patients about it, make it a little more streamlined. And so someone from a salon called and they asked if they could post that at their salon, just that education about PAD. And so it just made me so happy to see that it's creating this community change.
Yes.
Oh, that's awesome.
Great.
Yeah.
It's interesting.
Yeah, it was super hard, but very interesting, and it went by really fast. So
Oh, that's awesome. All right. So my next question, so I think we've given our viewers, our listeners, a great way of kind of seeing what the DNP looks like for that post MSN degree. So again, what courses are leading up to the final project, and then what that final project may look like. But I want to talk about things that you've noticed that have changed since you have obtained your DNP. So I'll start. I would say things have changed a lot since I got my DNP. Definitely, as I mentioned earlier, I feel like I'm a stronger clinician. My leadership, I feel like, is stronger. So it definitely gave me a lot of skill set that I didn't know I needed, but it has only strengthened me in multiple avenues. My DNP, and I get this question a lot too, definitely did open doors for me. I do healthcare consulting now. And I don't want to say it's a direct result of my DNP, but the company I work for loves that I have that DNP. They actually did research and like what the kind of degree was, and it was important for them that I had that DNP. So in regards to jobs, definitely has opened a lot of doors for me and a lot of avenues of not only having different financial streams, but just different things for me to do. And not that I still love being a nurse practitioner. I still practice, and I can't see myself giving that up anytime soon. It's actually one of my favorite things, but just in regards to publishing, again, doing consulting, a lot of doors have opened up for me after having my DNP. So KCD, what things would you say that you've noticed that are different or doors that have opened?
Well, you know what, to be honest, personally, I feel like I have better personal satisfaction with my terminal degree.
That's
like,
awesome.
I did this for me. I did this for my family. This was always a dream. My grandparents were very instrumental in getting your education. I just feel like I'm a better leader, better communicator. I feel like if there's something going on in the field where people are unsure, I just go back to, let's go look at the Cochrane reviews. Let's go do a literature search. And a lot of them don't even know what this is.
Yes.
Still, as nurses and just nurse practitioners in general. So giving them the education, encouraging them to find the best practice through Valpo. I still use their library website. Yep. To help improve those around me and my patients and our patients. So this is only going to pay it forward to our future. Yes.
I love the way you worded that. I think that's great. And just personal satisfaction is huge. It really is.
Yes.
Right. KCH, I know that you are not officially done for a couple more weeks, but you're so close. What are your thoughts on your DNP?
So I think just doing the QI project now, I'm seeing all these things that, in my practice, I'm like, oh, we could do better at this, or we could do better at that. So I think my lens has kind of changed a little bit. And instead of just simply practicing, I'm like looking how to make things better. And so I, like I said, I still would like to teach, but I think I've gotten really interested in the quality improvement aspect and just seeing how, I can create change. I've had a practice reach out to me that wants me to come and speak to them about my project. So kind of like the whole, I had no idea about consulting and never had thought about that before. But I've had one project, one practice site want to talk to me about that. And then another one that was curious if I could come in and actually just continue this type of project at their practice. So I can already see, without me even graduating yet, that those doors are starting to open already.
Oh, that's awesome. That's awesome. And ultimately, our goal is always to provide best patient outcomes, right? And you make a really good point by being able to identify things that need change and then helping with that change. And I think the way you verbalized that was perfect too. I think previously, before, it was kind of just, I don't want to say going through the motions. I don't mean that in a negative way, but lacking the ability to fully see the full picture and what needed to potentially be changed. And then how, not only identifying that, but then what do you do next? Because that's the hard part, right? So you can identify a clinical problem, but then what's the next step that I need to take, or that I need to get people on board to take to help solve this problem to improve our patient outcomes. So
I agree.
Awesome. Well, thank you, ladies, so much. Does anybody have any closing words again about just MSN to DNP, ways that it helped you, advice, anything like that?
Personally, I want to encourage those who are even thinking about going back for your DNP to talk to somebody from the university, reach out, network. I'm free. Dr. Spain, you would be a great resource as well to talk to, and just ask about it. Ask about the time requirements, or with the whole program. And if it's right for you, just go for it. Have no regrets. Just go. Just do it for you and your family.
Yes. Great.
I think often we, our own selves, are the ones that are kind of standing in our way. I know there's something called like imposter syndrome, and I definitely had that, where I had the skills, but I just thought, I felt like I was a fraud, like I'm not really capable of this. But so when I got my own self out of the way, I realized like I'm fully capable of doing this, and many of you are too. So I really encourage you just to pursue it.
Yeah. Oh, that's awesome. Well, thank you, ladies, both so much. I think this was a very valuable podcast, again, with a topic that I'm asked about a lot. And I know you guys are probably asked about it frequently as well. Once people find out that you did pursue that, just the why and how is it helpful, or how does it prepare you differently? So thank you guys so much. Thank you to our listeners and our viewers, and we will catch you on the next podcast. Bye, everyone.
Thank you.
Thank you.